Good morning, everyone. My name is Wenyang Li. I come from the First Hospital of China Medical University. Today, I would like to share with you one of the most common diseases in respiratory department. But before this lecture, I would like to share with you a very common clinical case that's seen in our ward. As you can see, this is a 71-year-old woman who has been admitted to the hospital with right lower lobe pneumonia. She has histories of prior pneumonias and multiple admissions to the hospital. She also has a chronic daily productive cough with mucopurulent sputum. As well, she has a chronic diarrhea. Her physical examination revealed that she's very thin and she has respiratory distress. During her long auscultation, we can hear that she has diminished breath sound on the right lower lobe with moist crackles. And as you can see from the picture, this is her chest X-ray. It shows that there are numerous ring shadows, which represents the dilated airway in the right lung. So based on these informations, what do you think is the diagnosis of these patients? Is it a pneumonia? Or if she has is bronchiectasis? Okay, what we have today is called bronchiectasis. So in this class, we are going to share with you some knowledge regarding bronchiectasis. What is bronchiectasis? In general, bronchiectasis is a congenital or acquired disorder involving dilation and compensation of the large bronchi. It usually is secondary to chronic recurrent inflammation. And once upon a time, bronchiectasis was a common disabling and fatal condition in the pre-antibiotic era. Even in the developing world today, it remains an important cause of suppurative lung disease. And as a result, the prevalence has been estimated to be 52 per 100,000 people. Okay, let's have a look at the definition of bronchiectasis. Bronchiectasis is a condition anatomically defined by chronic, irreversible dilation and distortion of the bronchi. It is usually caused by inflammatory destruction of the muscular and elastic components of the bronchial walls. This kind of irreversible airway dilation can involve the lung in either a focal or diffuse manner. And also, it can be classified clinically into 4 categories, including cylindrical, tubular, varicose, and cystic. So among all these 4 categories, the previous 2 types are the most common type that usually can be seen at the clinic. Clinical consequences include chronic and recurrent lower respiratory tract infection and the chronic production of mucopurulent or purulent sputum. Then let's have a look at the etiology of bronchiectasis. Okay, in general, the underlying conditions associated with the development of the bronchiectasis can be either acquired or congenital, with the previous one more frequently seen in our clinic. And among all the acquired elements, post-infective are the most common causes. As you can see, it could be either bacterial pneumonia or viral infections and so on. The second acquired reason is the proximal airway obstruction. It can be either a foreign body obstruction or a benign airway tumor obstruct that blocked the tube of the airway. And all these 2 situations can lead to middle lobe syndrome. Besides the above-mentioned acquired reasons, other less common congenital causes can also lead to bronchiectasis. It includes anything that impairs the ciliary clearance system, such as some abnormalities directly associated with the ciliary dysmotility that can result in the deficiency of mucociliary clearance. Other congenital causes may be associated with humoral immune deficiency, such as the deficiency of IgE, IgM, and IgA, as well as what we have that is called the HIV, right? They all predisposes patients to recurrent pulmonary infection, include opportunistic infections that eventually ended up in bronchiectasis. Other reasons belong to the congenital etiologies is the genetic disorders, such as cystic fibrosis. Cystic fibrosis is usually seen in European countries, and it consists of up to half of the cases in the US. That is quite different from what we have in China, right? As well, patients with alpha-1 antitrypsin deficiency have been found to be particularly susceptible to bronchiectasis for unknown reasons till now. Okay, that's all for this lecture. Thank you.